Now let's talk about living with the horror of the face-eating disease known as Noma. It's a devious, gangrenous infection that lurks beneath the surface of the skin, eating away at the flesh and bone of a victim's face. It affects mostly children between the ages of 2 and 6 in regions of extreme poverty such as northern Nigeria as well as other parts of Africa and Asia, and if left untreated will almost certainly lead to death. Those who survive are left with substantial facial disfiguration that requires repeated reconstructive surgery to repair. So, as Nigeria today marks the National Day of Noma, how is the country mobilizing in the fight against this monstrous and shocking disease? With more on this, I'm joined now in the studio by the National Coordinator and Head of the Noma Center in Abuja, Dr. Charles Ononiwu, and by a member of the Board of Trustees of the Noma Center, Roland Mittermayer, who is also the architect who designed the building for the Noma Center, and that building was opened today, wasn't it?
Exactly, Charles.
Yeah. Well, good work that you did there, and we'll come to you in a minute, but let me start with you, Dr. Ononiwu. Tell us about this flesh-eating disease called Noma, which disfigures the face of mostly children. I mean, we saw the video there in the most horrific ways.
Yeah. Okay, thank you so much for having us. Yeah, Noma disease is not just a disease that just appeared now. It has been there for years. It has been there for years, and it usually affects children, as we said, children between 2 to 6, 2 to 6, and the children that it affects mainly are children that are from very poor environment. They also have low immunity. You know, these are predisposing factors, things that affect it. It's actually an infection. It's a bacterial infection, so to speak, you know. Sometimes we say that it's the face of poverty, you know. So what happens is this. By the time the person is poor, or the parents are poor, their nutrition is very, very low. They have very, very poor nutrition. So they don't have much of, you know, protein, energy, nutrition, you know. And then, of course, quite a number of these people that are affected are very, very ignorant. And that is actually the major thing that leads to the devastating disfigurement. Because if it is caught early, it is something that can be taken care of by basic antibiotics. Basic antibiotics that is not even expensive.
But obviously when you live in a place where healthcare is not really available.
Yes.
I mean, that makes it difficult.
Yes, it makes it difficult.
And I understand, Mr. Mittermayer, that the disease has no cure and no one quite knows its origin.
Yeah, it's true. Well, it's curable when you operate them. No, the disease stops at a certain point, but then the kids are left behind with holes in their faces and everything. So you just have to they have to be operated, and not just once, several times over years. And that's what makes it so special, also the building in the end, because they have to live there. It's not that the kids are going there and leaving. No.
So obviously you had to sort of keep that in mind when you were kind of designing the building.
Exactly, yeah. And we were in other countries before, so in Niger and Guinea-Bissau, and we built a hospital and children's home. But in this place here, we created one building where it's all included.
And we're looking at that building now.
Yeah.
Which was open today, and congratulations, by the way, on doing that. That's a very significant thing that you've done. But Dr. Ononiwu, we know it's a deadly disease, but how much does it occur in Nigeria? What sort of numbers of infected people are we talking about?
Okay, I also want to correct a notion that it is not curable. We said it's treatable.
Right.
If it is discovered early, in time,
right.
As we said, simple, basic antibiotics will take care of it. However, when it is allowed to, you know, progress, because it's a very rapidly progressing infection, within 1 week, 1 to 2 weeks, it will do the destruction that, you know.
That is pretty scary.
Yeah. It's a rapidly progressing infection, and mortality rate is said to be about 90%.
Wow.
That means 9 out of 10 children that have it die. So it's only 1%, I mean, 1 out of 10 that survive, that now survive with horrendous, very terrible disfigurement.
So what sort of numbers are we talking about in Nigeria here,
in Nigeria, yes, basically, you know, statistics is an issue. So I wouldn't want to, you know, come here now and put
significant numbers,
but significant numbers, like, for instance, we have the Noma Center in Sokoto, you know, Noma Children's Center in Sokoto. And now, up till now, it has been the only hospital that is concentrating on treatment of Noma. And with the figures that we are given today at the ceremony, you know, we have about over 150 patients that they have treated this year that, you know, had, you know, new infections.
Right, and we were looking at the Noma Center there that you designed. How has it been designed to help the patients?
Yeah, that's the point. They are operated there, but of course the kids have to stay there sometimes for years.
They basically live there.
And so, they live there. So it's not just a hospital. It has to be a place where they are traumatized, not only the disease, but they are also taking away from their families or villages. So you have to create a place where where you don't copy the village, but you create your own, you know, fantasy where the kids have memories, and not the time they are staying there is not lost.
Right.
There's cool teachers and everything. And the good thing is that they are with other patients with the same disease. And it's not like in the village where they are hidden
they're
somewhere.
Isolated.
No, they're together, and it's not like strange people.
Right. Well, that was obviously an important consideration in designing that thing. And Dr. Ononiwu, I have to say that the pictures look absolutely horrendous and gut-wrenching. I mean, is it a disease that can be passed from one person to another?
No, it cannot be passed from one person to another.
Right.
And that's one thing we want to, you know, enlighten the public about. It cannot pass from one person to another. And you find out that you might also have siblings that are in the same home. It affects one. It does not affect the other person. And as I said, basically the cause itself is complex. Right now it's not fully known, but you have different factors that are interplaying, you know, that actually, you know, result to this. And researches are still on to know if there are any genetic links regarding, you know, why some siblings, I mean, somebody will get it, and the siblings that are in the same environment don't have it. But as I said, basically, basic hygiene is very important. Immunization, very, very key, because what happens is that for children that are not immunized, they're susceptible to childhood diseases like measles.
Right.
And when they come down with measles, their immunity is depressed, their immunity drops. And once their immunity drops, the bacteria that are in the mouth, that are normal bacteria that you know find in the mouth, they now kind of become violent and now start attacking the tissues, you know, in the mouth. And that's how it now spreads. Within 1 week, 2 weeks, a devastating destruction is.
Well, that's absolutely extraordinary. And Mr. Mittermayer, you are German, I take it.
Yes.
I mean, how did you get involved in this project?
Yeah, Ute Winkler-Stumpf, she was the founder 30 years ago. So she started in Niger. She was going there. She saw it on TV and in a TV show. And then she
was touched by it.
Yeah, touched. Right. She went there and just started. And so that's how the fire started. And once you get in, you can't get out, but in a positive way, you know, because you see you can help those kids, and nobody would help them. You know, it's crazy, but they are just left dying. And so when you go there and you see them after being operated, and in the end they have families, they have kids on their own, and they would never have that if you wouldn't have helped them. So
absolutely.
It's giving you,
well, what you're doing is very important, and we appreciate that. But let me ask you, Dr. Ononiwu, I know there was a campaign to try to get the world to pay attention to this disease. And one of the ways you were trying to do that was to get it placed on the WHO's list of neglected tropical diseases. Have you managed to do that?
The process is still on. The former Minister for Health championed it, and the present Minister for Health is also making a very strong push for it. And hopefully, it will be gotten. And the essence of that is so that there will be a focus on it. Because it's as if many people don't even know about it. But once it's brought to the front burner, there will be more awareness creation, and the message now trickles down to the rural areas where this occurs. And that will help in prevention, because actually they say the best treatment is prevention.
Absolutely.
Prevention. If poverty can be eradicated and ignorance is taken out, I think we live in a world without Noma. Let me just say this, because Noma is not fully tropical disease. Right now it's happening in the tropics. But before, it was there in Europe.
In Germany after the war, even.
Yeah.
No?
It was in Europe before, but by the time, you know, standard of living improved, awareness improved, you know, it was completely eradicated. But in our climate, you find out that there are so many people that are still ignorant. Basic oral hygiene, they don't even know how to do. So, so the focus, which Minister of Health is also championing, is trying to enlighten people in the rural areas on basic oral hygiene, basic, you know, proper feeding and immunization. If these things are put together and is passed down to the people in the rural areas and of course the urban slums, okay, you find out that it's a fight that we can win. Right. It's a fight that we can win. And
are you encouraged by what the Nigerian government is doing about it?
Yes, very much encouraged. Like, for instance, the Noma Center that is in Abuja now, okay, right now we are talking, we have over, you know, we have about over 20 patients that have, you know, that I've gotten a report about within the past 2 months, that we're also helping, you know, for their hospital fees in the rural areas. And these children, these are new Noma cases that are appearing. And we are looking forward to having these ones come to us in Abuja here, where they can have help. And that's also one of the good things about the center. Everything that we're going to do for these children, they're completely free. Right from their transportation to Abuja here, to their surgeries. And the surgeries are high-skilled surgeries. I'm a facial surgeon, and we have our colleagues in Nigeria that will be joining us during our campaign or during our intervention period. And we also have surgeons that will be coming from Germany and Austria to join us, because some of the surgeries, some of the cases need multiple surgeries, multiple high-skilled surgeries. But the beautiful thing is that the hospital is equipped with that technology to deliver very good.
Well, we congratulate you for the work you're doing, and thank you very much indeed to both of you. Dr. Charles Ononiwu is National Coordinator and Head of the Noma Center in Abuja, and Roland Mittermayer is a member of the Board of Trustees of the Noma Center and is the architect who designed that rather elaborate building that we saw earlier. Thank you very much indeed.
Thank you.
That's it for this edition of Arise Prime Time. Join us again tomorrow from me and the entire team here in Abuja. Bye-bye, and thank you for watching.